Hello, welcome to Anatomy DAHAR series. Today's our topic is about the larynx, the skeleton of the larynx, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Introduction to the larynx. The respiratory system consists of upper and lower respiratory passages. The upper respiratory passage is made up of nasal cavities and the pharynx. The larynx is the wide upper part of the lower respiratory passage. It is located along the midline of the anterior part of the neck, between the pharynx above and trachea below, at the level of 3rd to 6th cervical vertebrae. Although the larynx serves for phonation, its main functions are the air passage and to provide a protective sphincter of the air passage. Dimensions of the larynx vary with age, gender, race, and individual. Skeleton of the larynx. Larynx consists of framework of cartilages, connected by membranes and ligaments, lined by mucous membranes, and moved by muscles. These are the diagrams of the cartilages seen from right posterolateral view. Cartilages include 3 single cartilages: thyroid, cricoid, and epiglottic, and 3 paired cartilages: arytenoid, above them is conically, above them is cuneiform cartilages. So altogether a total of 9 cartilages, 3 singles and 3 pairs cartilages. The thyroid, cricoid, and basal part of arytenoid cartilages are made up of hyaline cartilage, so they may calcify or ossify after 25 years of age and are likely to be seen in the radiograph. The epiglottic, conically, and cuneiform are made up of elastic fibrocartilages. I put asterisks here. Epiglottic, cuneiform, and conically cartilages are made up of elastic fibrocartilages. Thyroid cartilage. In this slides, I am showing 2 diagrams, diagram A and diagram B. Diagram A is we are looking the thyroid cartilage from right posterolateral side. Diagram B, we are looking the thyroid cartilage from above. Now let's talk about the thyroid cartilage. Thyroid cartilage is the largest among the laryngeal cartilages. It acts as a shield to protect the larynx from the front and the sides. It is located at the level of 4th and 5th cervical vertebrae. Thyroid cartilage consists of right and left quadrangular shaped laminae of the thyroid cartilage, A here, right and left plates called laminae of the thyroid cartilage. Lamina is single, laminae is more than one. So these are right lamina and left lamina of the thyroid cartilage. The anterior border of 2 laminae meet in front formed a median angle called thyroid angle, B here. These 2 laminae meet in front. Here, 2 laminae of the thyroid cartilage meet in front and form thyroid angle. You can see here. It is not much different between gender before puberty. After puberty, the angle varies with the gender. In adult, it measures about 90 degrees, that is right angle in males, and about 120 degrees obtuse angles in females. Therefore, in males, it is prominence in front of the neck called laryngeal prominence or Adam's apple. This is the one, that is the thyroid angle. Thyroid cartilage continuation. We have another two diagrams here. Diagram A is the anterior view of the thyroid cartilage, and diagram B is right posterolateral view of the thyroid cartilage. In diagram A, we are looking from in front. This is the laryngeal prominence or Adam's apple. Above the Adam's apple, this is the superior border of the thyroid cartilage. There is a notch here separating the right lamina and left lamina of the thyroid cartilage. This notch is called superior thyroid notch, just above the Adam's apple. There is no such notch in the inferior border of the thyroid cartilage. If you see the diagram B, you can see right and left thyroid laminae are widely separated posteriorly. This is the right lamina, and this is the posterior border of the right lamina, and this is left lamina, and this is the posterior border of the left lamina. Each posterior border consists of two horns. The upper one is called superior horns or conue, and this is called inferior horns or inferior conue. So this is on the right side and this is on the left side. Each superior horn is connected to the greater horn of the hyoid bone, and each inferior horn articulates with the cricoid cartilage to form Cricothyroid joint. We'll talk about this one later. Thyroid cartilage continuation again. We are looking the thyroid cartilage from right posterolateral view. This is anterior. We re-identify again. This is right lamina and its posterior border. This is left lamina and posterior border. When you look at the outer surface of each lamina, you will see oblique line or ridge here going downwards and forwards. Each line consists of superior tubercle of the thyroid and inferior tubercle of the thyroid. Each thyroid ridge provides attachment to the following three extrinsic muscles of the larynx. They are from anterior to posterior. That is, number 1, thyrohyoid muscle, number 2, sternothyroid muscles, and number 3, inferior constrictor. That is, thyropharyngeal part of the inferior constrictor muscles. From anterior to posterior, they are attached to the oblique ridge of the thyroid, which ridge has tubercle, one above superior tubercle and one below inferior tubercle. Cricoid cartilage. This is the diagram of the cricoid cartilage seen from right posterolateral side. Cricoid cartilage is a cygnet ring-shaped cartilage, the only complete cartilaginous ring in the whole of the air passages. It is located at the level of 6 cervical vertebrae. The anterior part of the cricoid cartilage is narrow, called arch of the cricoid cartilage, but posterior part is wide, broad, flat plate called lamina of cricoid cartilage. Junctions between the arch and lamina, we have circular articular facet, where lower process or lower horns of the thyroid cartilage articulates and form Cricothyroid joint. Cricoid cartilage is in fact foundations of the larynx. Both thyroid and arytenoid cartilages are attached to it and form synovial joints. One is Cricothyroid joints here, thyroid cartilage is attached to the cricoid cartilage. Another one is Cricoarytenoid joint is here, where arytenoid cartilages are attached to the cricoid cartilage. So cricoid cartilage is in fact foundations of the larynx. Cricoid cartilage, continuation. This is the posterior view of the larynx. You are seeing posterior surface of the epiglottic, thyroid cartilages, arytenoid cartilages, and lamina of the cricoid cartilage. This is the upper border of the lamina of the cricoid cartilage. It has sloping shoulder on each side. It carries articular facets to articulate with the arytenoid cartilages. They are sitting over the upper border of the lamina. The posterior surface of the lamina has a midline ridge with shallow cavity on either side for muscular attachment. The midline ridge gives attachment to the longitudinal muscle fibers of the cervicus, which lies behind the lamina of the cricoid cartilage. Epiglottic cartilage. We are showing two diagrams here. Diagram A is posterior view of the larynx. This is epiglottic. This is laminae of the thyroid cartilage. This is arytenoid cartilages, and this is lamina of the cricoid cartilage. Diagram B is the sagittal section of the larynx, showing the inner surface of the left wall of the larynx. This is anterior. Epiglottic cartilage, this is the one, is leaf-shaped, slightly curled flat cartilage located behind the root of the tongue. Its upper end is free and wide, you can see here, and forms the upper boundaries of the laryngeal inlet, A. The lower part of the epiglottic is prolonged into slender process called the stalk of the epiglottic. This is the stalk here. This is the stalk of the epiglottic. The stalk is attached to the back of the angle of the thyroid. Below the thyroid notch by thyroepiglottic ligaments. Posterior surface of the epiglottis is indented by several small pits, which mucous glands are embedded inside the pits. Epiglottic cartilages, continuation. This is a diagram, superior view of the oral cavity and laryngeal cavity. This is the root of the tongue, and this is the larynx. This is epiglottic. Between the tongue, glossus, and the epiglottic, we have three mucosal folds, one median and another two, one on each side, lateral glossoepiglottic folds. Between the folds, we have shallow depression called vallecula. So, between median and lateral vallecula, and here median and lateral, another depression called vallecula. Arytenoid cartilages. We have two diagrams here. Diagram A is the posterior view of the larynx. This is the thyroid cartilage. This is lamina of the cricoid cartilage. Over the upper border of the lamina, that is the sloping shoulders, we have a pair of arytenoid cartilages. They are sitting on the upper border of the lamina. This is very diagrammatic pictures of the arytenoid cartilages seen from right posterolateral side. Now we are going to talk about the arytenoid cartilages. They are a pair of three-sided pyramidal shaped cartilages located on the sloping shoulder of the cricoid lamina. When we say we are three-sided pyramidal shaped, that means they have three surfaces: medial surface, posterior surface, and anterolateral surfaces, and the base below and apex above. Here we can see, if you see this diagram, very simple diagram. Here, the base, we have one anterior process where vocal cord is attached, we call anterior or vocal process, and another here lateral process where intrinsic muscles of the larynx are attached, we call muscular process on the lateral side. This is the apex. Apex is articulated by Conically cartilage. You can see here. Conically and cuneiform cartilages. The diagrams is looking from right posterolateral side. You know these are a pair of arytenoid cartilages, apex of the arytenoid cartilages. Now we are going to talk about Conically cartilages of Santorini. This is the one. It is lying above the arytenoid cartilages and articulated with the apex of the arytenoid cartilage. This Conically cartilage is lying in the posterior ends of airy epiglottic folds, that is mucosal fold between the apex of the arytenoid cartilage and side of the epiglottic. Next, higher than this is cuneiform cartilage of Risberg. It's a very tiny rod or club-shaped cartilages. Each is lying in the posterior part of airy epiglottic fold just above the Conically cartilage. Cuneiform cartilage does not articulate with any other cartilages, but Conically cartilage articulates with the apex of the arytenoid cartilage. Joints of the larynx. Cartilages of the larynx are articulated by three pairs of joints. Number one, Cricothyroid joints between the cricoid cartilage and the thyroid cartilage. Number two, cricoarytenoid joints between the cricoid cartilage and arytenoid cartilage. And number three, arytenoconically joints between the arytenoid cartilage and conically cartilage. Number one, cricothyroid joint. It is between the inferior horn of the thyroid cartilage, that is inferior conure of the thyroid cartilage, with the side of the cricoid cartilage. It is a synovial joint of plane variety. It limits rotation movement around the transverse axis that passes between the two joints. Here is the transverse axis which passes between the right cricothyroid joint and left cricothyroid joints. So around this axis there is a rotations between these two cartilages, so that one cartilage can rock backwards and forwards on the other with a limited gliding movements. So this cricothyroid joint has slight rotation and gliding movements between them. If you see the diagram very carefully, Behind this joint, cricothyroid joint, we have recurrent laryngeal nerve is here. It is very closely related to the posterior part of the cricothyroid joint. Joints of the larynx continuation. Second joints are cricoarytenoid joint. It also is a synovial joint of plane variety between cricoid and arytenoid cartilages. The capsule of this joint is lax. It allows a gliding and rotation movements of the arytenoid cartilages on the upper border of the cricoid lamina. By gliding of the arytenoids laterally, the gap between the vocal folds, rami glottis, is open in a shape of a V. The apex of the V in front. See figure A. So by gliding laterally, you have a V-shaped rami glottis. By rotation of the arytenoid laterally, that is abduction of anterior vocal process, the rami glottis is open in the shape of a diamond, like a lozenges. See figure B. So when the arytenoid cartilage abduct, rotate laterally, the opening of rami glottis is now diamond shape. There is a greater range of gliding than that of rotatory movements. Therefore, the shape of the rami glottis is more of a V, like in figure A, and less of a diamond in figure B. Joints of the larynx continuation. The third joints are arytenoconically joints. It also is a synovial joint between the apex of the arytenoid cartilage and the base of the conically cartilage of the same side. There is no functional significance of this joint. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.